It could, and so we look at who is on Medicaid in Minnesota Care to see who's most impacted. And, I think that there's some misconceptions about who's on Medicaid. 58% of our Medicaid spending as a state goes to seniors and people with disabilities. And so it not only impacts children and families and adults without children, but it impacts these really vulnerable populations that we think of as covered by other insurance, when in fact Medicaid is the primary funding source for nursing homes, for example, all across the state. And so it's really a challenge for the 1 in 5 Minnesotans that are on our public health care programs, but also all of the rest of the people in Minnesota who rely on those folks. It could be aging parents having their coverage in nursing home care paid for.
Mm-hmm. What would you like to see done?
I think that Minnesota's been a real leader across the country in healthcare for many, many years. And I have said from the start, as these conversations are happening, that I think that any replacement to the ACA should meet 3 basic criteria. Minnesotans shouldn't lose coverage. Coverage should be as affordable and comprehensive as it is today, and the cost-saving innovations in healthcare that we have done in Minnesota should continue and be carried forward, and also be used as a model nationally to try and drive down some of the costs that we see rising in states that perhaps haven't been as innovative as Minnesota. We have a website, mn.gov/DHS/ACA-repeal. And there you'll find not only a statewide source of information relating to the Affordable Care Act's repeal, but also a breakdown by congressional district. So for your folks that are in the 1st Congressional District, you can see the impact on the 1st Congressional District there, as well as the statewide data.
Very good. Emily Piper, thank you very much.
Thanks for having me.